Did you know that more than 90% of healthy adults over 75 who undergo full-body scans are told they have some kind of abnormality? What's even more surprising is that in most cases, these findings are completely harmless and would never cause any issues. Yet what follows? Anxiety, additional tests, biopsies, and sometimes even unnecessary surgeries, all for conditions that would never have impacted their health. I'm Dr. James Cole, and over the years, I've seen this situation play out far too often. Today, I want to walk you through 5 common medical screenings that can sometimes do more harm than good after the age of 70. This isn't about avoiding healthcare, it's about being smart and intentional with it. So, if you're over 70 or caring for someone who is, this is worth paying attention to. What I'm about to share could help you avoid unnecessary procedures, serious complications, and a lot of stress. Before we dive in, let me be clear. I'm not saying you should skip medical care altogether, or that these screenings are never appropriate. What I am saying is that the risk-benefit balance shifts as you get older. What's beneficial at 50 can actually be harmful at 80. Medical screenings are all about balancing risks and benefits, and that balance shifts as you get older. Every test I'm going to mention today has a valid role in medicine. I've personally ordered them when it made sense. But the problem starts when these tests are done routinely and automatically, just because someone has reached a certain age. Let's start with number 1, full body scans. You've probably seen the ads. Get a complete picture of your health. Catch problems before they even begin. Clinics charge thousands of dollars for these extensive screenings, promising peace of mind. Sounds great, right? I mean, who wouldn't want to catch everything early? Here's the problem. These scans are very good at finding things, but in medicine, finding something isn't always a good thing. Research shows that up to 40% of people without any symptoms who undergo full-body MRI scans end up with findings that need follow-up. Most of these are what we call incidental findings, things discovered by chance that would never actually cause any harm. A tiny cyst in the kidney, a small nodule in the lung, a benign growth in the liver. These are incredibly common as we age. In many ways, they're like wrinkles or gray hair, just a normal part of getting older. But once something is found, it can't be unfound. Suddenly, you're labeled as having an abnormality, and your doctor feels the need to investigate further. That can mean more scans over the following months. It might mean a biopsy, which comes with its own risks, like bleeding or infection. In some cases, it can even lead to surgery or other treatments for conditions that were never going to cause any symptoms in the first place. And it all starts with a scan that may not have been medically necessary to begin with. There's also another concern. If the scan is a CT rather than an MRI, you're being exposed to radiation. A single full-body CT scan can expose you to as much radiation as hundreds of chest X-rays. While the risk of cancer from a single scan is low, it's not zero. So why take on that risk without a clear medical benefit? So what's the better option? A comprehensive geriatric assessment. This isn't just a routine checkup. It's a thorough evaluation that focuses on what actually matters for your health and quality of life at this stage. It looks at your functional status, your balance, grip strength, and walking speed. Simple as they sound, these measures often predict your overall health far better than any scan. It also includes a careful review of your medications. Many older adults take 10 or more prescriptions, and side effects are often mistaken for new health problems. And it goes beyond that, looking at lifestyle factors like nutrition, sleep, physical activity, and social connections. These are the true foundations of long-term health. A comprehensive assessment gives you something useful, clear, actionable steps to help you stay healthy and independent. A full-body scan, on the other hand, often just creates anxiety and leads to more testing. Now let's move on to number 2, brain MRIs for mild memory loss. This is incredibly common. Someone over 70 forgets where they left their keys or can't recall an actor's name. Naturally, the family gets concerned and pushes for a brain scan to rule out Alzheimer's disease. The intention behind it is good, but the outcome is often problematic. Studies show that about 94% of people over 75 who undergo brain MRIs have some kind of abnormal finding. Just think about that, 94%. These findings can include things like mild brain atrophy, which simply means the brain shrinks slightly with age. That's completely normal. Or white matter lesions, small spots that may look concerning, but are actually seen in more than half of older adults. In many cases, they just reflect long-standing high blood pressure. The issue is how these results are interpreted. If you're 78 and your report mentions cerebral atrophy or white matter disease, It sounds alarming, but to an experienced physician, that report is essentially saying, this is what a 78-year-old brain looks like. To you and your family, though, it can sound like the beginning of dementia, and that fear can have real consequences. People start to second-guess themselves. They pull back from activities they once enjoyed. They lose confidence in their own thinking, all because of a scan finding that may have nothing to do with their actual cognitive function. And here's the most important point. These imaging findings don't actually change how mild memory problems are treated. There's no medication that can reverse normal age-related brain changes, so the scan won't help and will only cause anxiety. A better approach is simple cognitive testing done in a doctor's office. Tests like the Mini Mental State Exam or the Montreal Cognitive Assessment take about 10 minutes and measure how the brain actually functions, not how it looks on a scan. If the results are normal, you and your family can relax. If the tests show problems, that's when we look for reversible causes. Many of these causes are common and treatable: vitamin B12 deficiency, thyroid problems, depression in older adults, sleep apnea, and certain medications such as sleeping pills or anxiety drugs that can impair thinking. All of these should be checked before considering a brain scan. If cognitive tests show a progressive decline over time and reversible causes have been ruled out, imaging might be appropriate as part of a complete evaluation. But for simple forgetfulness, brain scans are not the solution. Third, let's talk about routine stress tests for the heart. This topic often confuses people. Isn't it good to know the condition of your heart? The problem is that stress tests in asymptomatic older adults have a very high false positive rate. That means the test can indicate a problem even when there isn't one. Why does this happen? As you age, changes in the heart and blood vessels can affect stress test results, even if there's no dangerous blockage. Conditions like long-standing high blood pressure, thickening of the heart muscle, or electrical changes in the heart can all make stress tests look abnormal, even if the coronary arteries are fine. So what happens if you get a false positive? You're usually referred for more testing, often a heart catheterization. This involves inserting a tube through your arteries into your heart. It's an invasive procedure with real risks: bleeding, infection, artery damage, kidney problems from the contrast dye, and more. In many cases, the catheterization shows that your arteries are actually in good condition. The stress test was wrong, but by then you've already undergone a procedure with unnecessary risks. And sometimes the stress test itself can even trigger problems. Although rare, stress tests can sometimes trigger dangerous heart rhythm problems or even heart attacks in certain individuals. For someone who is experiencing symptoms like chest pain with exertion, a stress test makes perfect sense. We need to know what's happening. But for someone with no symptoms, who can climb stairs and walk briskly without issues, you're essentially already giving your heart a stress test every day. Your daily activities show that your heart is functioning well. If you want to understand your heart risk without the potential problems of a traditional stress test, there's a better option: the coronary artery calcium score. This is a quick, low-radiation CT scan that measures calcified plaque in your arteries. A score of 0 indicates a very low risk of a heart attack in the coming years, while a high score suggests that you should take aggressive steps with medication and lifestyle changes. It gives valuable information without the cascade of tests that might follow a false positive stress test. The fourth point is colonoscopy after age 75 to 80. I need to be very clear about this point. Colonoscopy is an excellent screening tool, and I strongly recommend starting it around age 45. It saves lives by detecting and removing precancerous polyps. My concern is whether routine colonoscopies are still necessary in later years if previous screenings have been normal and you have no symptoms. The reason is simple. The main benefit of colonoscopy is preventing colon cancer that might develop 5 to 10 years later. If your life expectancy is less than 10 years due to age or other health problems, the likelihood of benefiting from the procedure decreases. At the same time, the risks of colonoscopy increase with age. Even the bowel preparation can be dangerous for older adults. This preparation requires drinking large amounts of laxatives, which can lead to severe dehydration and electrolyte imbalances. In people with kidney disease or heart failure, this can cause serious complications. The sedation used during the procedure also carries higher risks in the elderly, including confusion, breathing problems, and dangerous drops in blood pressure. There's also a small risk of perforation, a tear in the colon wall. Perforation occurs in about 4 out of 10,000 colonoscopies overall, but the risk is higher in people over 75, especially those over 80. The colon wall thins with age, making rupture more likely. Perforation requires emergency surgery. This condition often requires major surgery and sometimes the use of a colostomy bag. For an 80-year-old, this could mean the end of independent living. Important medical guidelines reflect this changing balance between risk and benefit. The U.S. Preventive Services Task Force recommends that screening decisions for ages 76 to 85 be made individually, considering overall health and previous screening history. They suggest discontinuing routine screening after age 85. This doesn't mean ignoring the colon after 75. Instead, we shift from routine screening to surveillance. You need to know the warning signs and report them immediately. Persistent changes in bowel habits, blood in the stool, unexplained weight loss, new onset anemia, or ongoing abdominal pain. If any of these occur, age doesn't matter. Investigation is necessary. Prevention also remains crucial. A high-fiber diet is your best friend for colon health. Fruits, vegetables, whole grains, beans, and lentils feed the beneficial gut bacteria that produce cancer-preventing compounds. This approach is far safer than repeated colonoscopies and benefits your entire body, not just your colon. Our fifth and final screening is the PSA test for prostate cancer in men over 70. This issue has been controversial for years, and for good reason. The prostate-specific antigen, PSA test, has led to widespread overdiagnosis and unnecessary treatment. What makes prostate cancer different from many other cancers is that in most men, especially older men, it grows very slowly. Autopsy studies show that up to 80% of men in their 80s have prostate cancer, but most die with the cancer, not from it. The cancer was just sitting there, never causing problems. The problem is that the PSA test cannot distinguish between aggressive cancers that need treatment and slow-growing cancers that will never cause harm. So when these cancers are detected, men understandably want treatment, but prostate cancer treatment is not trivial. Surgery can cause permanent urinary incontinence and erectile dysfunction, and radiation therapy can cause similar issues. These side effects can seriously impact quality of life. The U.S. Preventive Services Task Force reviewed the evidence and concluded that for men 70 and older, the harms of PSA screening outweigh the benefits. The chance of finding a cancer that could actually be fatal is very low, while the risk of overdiagnosis and harmful treatment is high. Overdiagnosis rates are estimated to be 15 times higher in men over 85 compared to men in their 50s. But what about family history or other risk factors? Family history and other risk factors are absolutely important. They can tip the balance in favor of screening even after age 70. However, this should be a discussion, not an automatic test. You need an informed conversation with your doctor about the real numbers, the real risks, and what matters most to you. For men diagnosed with very low-grade prostate cancer, active surveillance is often the best option. This means monitoring the cancer without treatment unless it shows signs of becoming more aggressive. Regular PSA tests and occasional biopsies are used to track it, while avoiding the life-changing side effects of surgery or radiation for a cancer that is very unlikely to cause harm. So, to summarize, here are 5 screening methods that often cause more problems than they solve after age 70. Whole body scans. They find harmless abnormalities and trigger a chain reaction of unnecessary tests. Brain MRIs for mild memory problems. These often create anxiety without providing useful information. Routine cardiac stress tests. In older adults, these have a high false positive rate and can lead to unnecessary invasive procedures. Colonoscopies after age 75-80. If previous screenings were normal, continuing routine colonoscopies often provides little benefit while increasing risk. PSA tests in men over 70. These frequently lead to overdiagnosis and unnecessary treatment of slow-growing cancers. What do all of these have in common? They are all examples of searching for problems in people who have no symptoms. As we age, the chances that these kinds of screenings will benefit us decrease, while the chances of harm increase. I want to emphasize again, this is not about avoiding medical care, it's about smart medical care, focusing on what truly improves health and quality of life. A comprehensive geriatric assessment is far more effective than a full-body scan. For mild forgetfulness, a short cognitive test is more effective than a brain MRI. Knowing the warning signs and maintaining a healthy lifestyle is more effective than routine colonoscopies in very old adults. Honest conversations about goals and values are more effective than automated PSA tests. After age 70, the goal of healthcare shouldn't be to find every possible problem. It should be to preserve functionality, independence, and quality of life. Sometimes the most effective thing a doctor can do is not order a test, but sit down with the patient, listen, and focus on what matters most to help them stay active, connected, and engaged. If there's one message I want you to take away, it's this. You have the right to ask questions. When a doctor recommends a test, you can and should ask why. What will we do differently based on the results? What are the risks? What happens if I don't take this test? These aren't confrontational questions. They're the questions of an informed patient who has taken control of their own health. Medical care should be a partnership. You know your body, your values, and what matters most to you. Your doctor knows medicine. Together, you make decisions that make sense for you as an individual, not as a number in a guideline. So the next time someone suggests one of these tests, stop, think, ask questions, and make an informed decision. The goal isn't just to live longer, it's to live well, with dignity, independence, and happiness. Sometimes the best way to preserve that is to say no to a test you don't need. Thanks for watching. If you found this information valuable, please share it with others who might benefit. Subscribe for more evidence-based advice on staying healthy as you age, and leave a comment below. Have you ever felt pressured to take a medical test you weren't sure about? How did you handle it? I'd love to hear your experiences. Until next time, take care of yourself, and remember, knowing what to skip is just as important as knowing what to do.